Hey, it's Kimberly with Highland Physical Therapy, and we have decided to start a new program called Teaching Tuesday. And this is Katie Bushhorn. She is a new graduate of Idaho State University as a physical therapist, a doctor of physical therapy. And she has also had extra training on pelvic health and women's health. So, our first Teaching Tuesday topic is, what is pelvic health? A lot of people have asked some questions, so I'm going to ask for the people that have asked me, and Katie is going to provide the answers. So, what is pelvic health, PT, Katie?
All right, so just like with any other medical field, we do have specializations that we can go into. So, physical therapists, we kind of specialize in that musculoskeletal realm of the body. With pelvic health PT, I specialize in the pelvic floor, which is right in the base of our pelvis.
So, what is the pelvic floor?
Okay.
Do you need me to get you a visual aid?
Sure, that'd be
Okay.
great. So the pelvic floor sits right in the base of our of the pelvis, which she's bringing it over right now.
Here you go.
Look at that. So, pelvis floor, oh wow, we're falling apart, is right at the bottom. And then we have some extra ligaments that don't want to stay. That's okay. And it kind of sits at the bottom, and it really helps support all of our organs and everything inside. It actually has a lot of importance in how we function, how we move, and at times we can have a little bit of a dysfunction happening, and that can affect us in our day-to-day life. So pelvic floor is helpful in just helping maintain pressure in our abdominal space and making sure that we're not getting too much pressure, and providing that we do not have any extra issues within our bowels, even into our upper chamber, which is where our lungs are at. So.
Okay, so what are the most common reasons to see a pelvic floor PT?
So some of the common reasons, kind of was highlighting that a little bit earlier, is we can get a bit of a dysfunction. Most common that I see so far has been incontinence, is an issue that most women seem to have following pregnancy and postpartum. And it can affect men as well, even though they may not be quite as open about it. So that's one main common thing that I see. Another thing that that can be seen is pelvic pain. Can also have issues with just pain with insertion, pain with movement, kind of along that scale of things. So what I do is I kind of evaluate to see why are we having this dysfunction within the pelvic floor, and then as well as seeing what I can do to make that better for you. With pelvic floor therapy, it is there's a lot of things that can factor in. So these common reasons can be that maybe things are a little weak, things could be tight, things could be a little lax. So I kind of factor in all those things and try to make it so that we can strengthen or relax the pelvic floor, and then also factor in all of our functional movements that we do day to day.
Okay, well, that sounds like a lot.
It is.
And we have our favorite toy. This handheld device is actually an ultrasound. And the head right here is curved so that we can look inside to see your bladder and also your pelvic floor muscles, how they're contracting or relaxing, or if there's one side doing more than the other. And we are offering that right now with for a free 15-minute, we call it a discovery visit, so that you can come and take a look at our clinic, ask your questions, get them answered. And the beautiful thing about this is that it goes right on your belly. Just goes on your low belly. You don't have to disrobe, you don't have to have an internal exam, and it's very quick, very painless, and very easy. and gives us a lot of information that we can provide to you. So if you are interested in getting your 15-minute assessment, give us a call, 237-2080. So that's Teaching Tuesday for today. We'll see you next week.
All right.